Hi there, my name is Dr. Matt. I'm going to be your doctor today. Very nice to meet you. Wonderful. So I see here that you made an appointment. Okay, great. I would like to verify your first and last name first, if that's okay with you. Perfect, thank you. Just gonna write it down in my iPad. Good. And your date of birth, please. Perfect. Okay. Can I please have your full address? Okay. Yeah. And zip code? Perfect. Okay. Okay, so go ahead, tell me what's going on today. I see. Okay, I'm just gonna write this down. But I'm listening. So go ahead and tell me more. I understand. So you feel some twitching in your eyes. Okay. Are you experiencing any blurry vision? No. Good. Any double vision? Double vision. Okay. Any changes in your color vision? Okay. And any pain or discharge? Okay, I see. I can definitely take care of you today. What I'm going to do is I'm going to do a very deep cranial nerve examination of the eye. There are a few nerves that innervate specifically the eye, and I'm going to focus on those, if that's okay with you. Perfect. Okay, let's go ahead and talk about your medical history before we begin. Any history of atrial fibrillation? Okay. Good. How many times a week do you exercise, and what kind of exercise do you practice? Okay. Do you remember hitting your head in the last 6 months, let's say? Okay, good. Okay. Any history of hemorrhage retinopathy? Okay, good. Are you experiencing any floaters? No. Good. Okay. Wonderful. So let's go ahead and begin. Do you have any questions for me? Well, I don't think it's anything serious, but just in case, obviously, I want to do a very thorough checkup. Yeah. Okay. Let's go ahead and take your temperature. This is going to go on your forehead. Great. 99.1. It's perfectly normal. I'm going to take your oxygenation. This is going to go on your index finger. Any index finger works. Perfect. Just like that. And relax. Good. Take a deep breath in if you can. Okay, so your oxygenation level is 98th percentile on room air, and your heart rate is 76 beats per minute. That's perfect. Okay. If it's okay with you, I would like to listen to your heart and your lungs. Okay. This is going to go on your chest. Is it okay if I lift up your shirt? Okay, I'm just going to slide this underneath. Good. Perfect. Perfect. gonna move it. Okay. 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 Is it okay if I listen with the bell as well? Okay, very good. Wonderful. I'm not able to hear any abnormalities, only S1 and S2, which are very normal heart sounds, and I'm not hearing any S3 or S4, which are the abnormal heart sounds that usually you would hear with heart failure or atrial fibrillation or any heart dysfunctions. I'm going to listen to your lungs now. For that, I'm going to need you to take a deep breath in every time you feel the stethoscope touching your skin. Okay. But don't worry, I'm going to prompt you as well. Okay. So go ahead, take a deep breath in and out. Good. Again, take a deep breath in and out. Good. Okay. One more time, take a deep breath in and out. Wonderful. I'm going to listen to the sides, is that okay? And I'm going to slide the stethoscope underneath your shirt. Okay, I'm just going to lift it up a little bit. Good. And just relax for me. Take a deep breath in. Good. Take a deep breath in. And now exhale. Perfect. One more time. Take a deep breath in. And exhale. Good. Let's go ahead and listen to the other side. Take a deep breath in. Good. And exhale. Okay, perfect. Take a deep breath in. Wonderful. Okay. Can you do that one more time for me? Take a deep breath in. Good. And exhale. Okay, perfect. Your lungs are functioning very normal. I'm able to hear very normal sounds. No wheezing, no crackles. Perfect. I'm going to start by examining cranial nerve 2, which is purely the sensorial stimulation of your eye. With that being said, I'm going to go ahead and put on some gloves and I'm going to touch your eye, only around the eye, and make sure that sensorial stimulation is proper. Okay. Go ahead and relax. If it helps you to close your eyes, you can do that as well. I'm just gonna go ahead and touch your eye down underneath the eyelid. Perfect. Okay, good. And also let me know if you feel any kind of pain. So no tenderness. I'm not feeling any lumps around the eyes. Perfect. Wonderful. Okay, what I'm going to do now is I would like to check your sensitivity only around the eye. Okay, so I'm going to touch your skin with something cold. Can you please tell me exactly where you feel it? Okay, perfect. Alright, let's go ahead and begin. Do you feel that? Okay, and do you feel that? Wonderful. Feel that? Good. Perfect. Perfect. Okay. Good. Okay. And did you feel the same amount of coldness in both eyes? Wonderful. Okay. Okay, now I'm going to have you close your eyes, and I'm going to touch your eyes with a very fluffy object. Can you please tell me where you feel this? Left eye, perfect. Where do you feel this? Above your right eye, wonderful. Where do you feel this? Above your left eye, good. What about now? Right forehead, good. What about now? Wonderful. What about now? Underneath the right eye. Good. What about now? Underneath left eye. Perfect. And did you feel that equally on both sides? You did. Great. What I'm going to do now is I'm going to touch you with a different kind of object. But now what I need you to do is to look up, and I'm going to touch your eye bulb. Okay? Yeah, exactly. The white part of your eye. Great. Okay, so go ahead, look up for me. Great. Very good reaction. I'm going to do that on the same thing on the other side. Wonderful. Very good reaction as well. Next, I'm going to check your light reflex. For that, I'm going to need to place a few drops in your eyes. Is that okay? Okay, perfect. So it's going to help me better visualize inside the eye. I'll also check your nerves and your reflexes. Perfect. So go ahead, look up and just drop your head a little bit. Okay? Good. Gonna do the same thing on the other side now. Same thing, look up. Okay. We're going to wait a minute or two. In the meanwhile, I'm just gonna go ahead and write some notes. Okay, I believe I forgot to have you sign the consent form. Is it okay if you sign it now? Okay, perfect. So go ahead and sign it right over here. Good. Thank you. Okay. I'm going to check your light reflex. Okay. So what I'm going to need you to do is to look right here at the Snellen chart behind me, and I will flash a light in your eyes. Okay. I'm gonna do the same thing on the other side. Good. Perfect. Now can you please look up? Good. Look up. Okay. Look at this side. Perfect. Now can you please look down? Look down. Good. Look down. Okay. And I'm going to swing the light in your eyes. It's going to be a little bit uncomfortable, but just for a few seconds. So just go ahead and try to follow the light without moving your head. Good. 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 Wonderful. Okay. 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 And now we're going to do it vertically. Perfect. Okay. So go on, just keep on looking at the light. Good. Okay. Okay, now go ahead and look straight in my nose. Good. Look right here in my nose. Okay, good. And I'm gonna go ahead and measure your pupils. Okay. Look straight. Okay. Good. And I would say your pupil size is 3 millimeters, which is perfectly normal. They're round and symmetric. Good. And they're also equal in size in both eyes. So that's a very good sign. Okay. Now I would like to check your optic nerve with the otoscope. So I'm going to have you look at the wall behind me. Maybe right here. That's perfect. So go ahead and keep your eyes as open as you can. I'm going to flash a light inside your eyes. I'm going to start with your right eye first. Okay. And for this exam, I need you to pinch your nose and hold your breath. Okay. Would 15 seconds be okay for you? Okay. Wonderful. So go ahead, look behind me, and pinch your nose and hold your breath. Great. Okay. I'm not noticing any inflammation, which is great. Okay. No scratches. Retina looks looks very clear, opaque. Wonderful. No blind spots. Good. Okay, you can take a deep breath in now and breathe out. Okay. I'm going to do the same thing on the other side, if that's okay with you. Great. So go ahead and look behind me at the wall. Okay. And go ahead, pinch your nose and hold your breath. Perfect. How's that? Good. Alright, I'm not seeing anything abnormal here either. I'm seeing only normal nerve. No inflammation, no redness. Margins are very well defined. Perfect. Go ahead and breathe out. Good. Wonderful. Okay. How are you feeling so far? Perfect. Can you please tell me what color this is? Red. Great. So what I'm going to need to do is I'm going to cover one eye for you. Okay? And tell me when you see the red ball in your field of vision. Now, good. Now, good. Now, good. I'm going to do the same thing on the other side. Same thing. Tell me when you see the red ball in your field of vision. Now, perfect. Now, good. Now, wonderful. And was the red color same on both sides? Perfect. Can you please tell me what color this is? Green. Perfect. So what I'm going to have you do is to follow the green ball, and I'm going to swing the red ball as well. But please don't focus on the red ball, only the green ball. Don't move your head and follow the green ball only with your eyes. Good. Perfect. Okay. And at some point, I'm going to remove the green ball from your field of vision. Please tell me when you don't see it anymore. Now? Perfect. We're going to do the same thing, but now please focus on the red ball. Okay. And don't let yourself distracted by the green ball. Good. Good. Perfect. Okay. And now I'm going to remove the red ball from your field of vision. Tell me when you don't see it anymore. Now, perfect, wonderful. I'm going to place a color in your field of vision. Can you please tell me what color this is? Orange, very good. Now I'm going to ask you to identify how many fingers I have up. 2, very good. How many fingers do I have up? 1, perfect. Can you please tell me what color this is? Green, wonderful. Can you please tell me what color this is? Red, perfect. Can you please tell me what color this is? Purple, good. Can you please tell me what color this is? Blue, wonderful. I'm gonna have you follow the light with your eyes only. Don't move your head. Good. Perfect. Okay. And now I'm going to introduce the green ball in your field of vision. Please tell me when you see the green ball. Now, wonderful. Now, can you please look at the light? Good. Follow the light. Perfect. Look at the green ball. Good. Good. Look at the green ball. And now look at the light. Perfect. Okay. That looks good. Can you please tell me what shape I'm drawing? Triangle. Wonderful. Can you please tell me what shape I'm drawing now? Circle. Excellent. Can you please tell me what shape I'm drawing now? Very good. Square. Square. Okay, can you please tell me what shape I'm drawing now? This is going to be a very hard one. It's a star. Very good. So far, everything looks very good. No concerns there. Okay. I usually like the handheld snellen chart as compared with this one. I feel that you can see it better and hear better. So let's go ahead and cover one eye. Very good. Can you please tell me what letter this is? Wonderful. What letter is this? Good. What letter is this? Perfect. Can you please read the last row, starting with the first letter? L. Good. D. Good. F. Good. P. Good. H. Wonderful. Can you please tell me what color this is? Good. What color is this? Perfect. And can you please tell me what number you see right here? Good. And what number do you see right here? Perfect. And which circle is smaller? Number 2 or number 6? Okay, very good. Next, I'm going to check your vestibular ocular reflex. So what I'm going to have you do is I'm going to have you turn your head this way. Can you do that? Perfect. And as you can tell, your vision shifted that way, okay? I'm going to have you just keep your head directed towards that way, towards the door, and now just swing your eyes to the light and look at the light. Perfect. Okay. I'm going to do the same thing on the other side. So go ahead and look that way. Perfect. And as you can tell, your vision shifted that way as well. But now I need you to look at the light without moving your head. So go ahead, keep on looking that way and just look at the light. Perfect. Looks very good. Go ahead, you can look straight at me now. Wonderful. Next, I'm going to check your muscles as well. So I'm going to have you close your eyes and I'm going to try to open your eyes. Don't let me do that. Perfect. Now I'm going to have you raise your eyebrows just like that. Very good. And please try to open your eyes as much as you can. Just like that. Perfect. And now finally I would like to check your cranial nerve 7. Okay, which is the blinking reaction of the eye. I was able to notice that you blinked pretty well, but I still want to go ahead with this test to make sure that I'm not missing anything. Okay, so I'm going to move my finger in your field of vision, and every time I do this, I need you to blink. Does that sound okay? Perfect. So go ahead, follow my finger with your eyes only. Good. Don't move your head. And remember what I told you? Okay, good. Okay, blinking. Very good. Let's go ahead and do that a few times. Good. Wonderful. Good. Good. Okay, now I'm going to do a little bit faster. Good. 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 Okay, perfect. Good. Okay, so as I can tell, your blinking sensation is very normal. Okay. Unfortunately, all the tests that I did today are normal. I'm not noticing any abnormalities. Do you still feel that blurry vision and all the symptoms that you had when you came in? No, they all went away. Okay, this is very good. Let's go ahead and just take some notes over here. Okay, no eye closure. I'm not seeing any ptosis. Normal eye movements in all directions. All cranial nerves are perfect. Okay. Well, if the symptoms, come back, don't hesitate to make another appointment. Wonderful. Well, otherwise, it was very nice to meet you, and I'll see you back soon. Perfect. Okay. Take care now.